As you would have heard with Peter Credlin last night, Victoria's ambulance service has gone beyond breaking point. A code red was declared for 4 hours in the early hours of yesterday morning, with patients told to make their own way to hospital. At one stage during the 4-hour window, no ambulances were available, even for people experiencing a critical emergency such as a heart attack or a stroke. Let's bring in Georgie, Crozier, Victoria's Shadow Health Minister. Thanks for talking to us again, Georgie. This has been going on forever. Why can't it be fixed?
Well, Chris, it needs to be fixed. I mean, these are really dangerous, serious situations. Another code red. We've had 6 in, just the last few months. That means there are no ambulances available for when you need it. Every second counts if you're having a heart attack, and it can be the difference between a life saved and a life lost. And this is unacceptable in 2022 that we are dealing with this, and it's ongoing. We're hearing that a code orange happens 2 to 3 times a week, and these code reds are happening far too frequently as well.
Look, it's so basic, but there seem to be a number of issues here. There's been a focus on, of course, the emergency dispatch system, and then you've got to ask whether or not the ambulance services have enough resources. But, of course, it's the hospitals where the choking point occurs. There's not enough beds to admit people, so you have this ramping going on. It's not the only state where it's occurring. It just seems inconceivable in our modern age that you can't get people out of ambulances into hospital care. If there's not enough resources there, surely those extra resources need to go in there.
Well, Chris, this is the Andrews government's just failed yet again on this. I mean, here in Victoria, we went into 6 lockdowns. We had the longest lockdown of anywhere across the country, and we were told we needed to prepare our health system. Of course, ambulance is part of that health system, and yet it is worse than ever. This health crisis is worsening by the day, and it's putting too many Victorians' lives at risk, as we're seeing with these code reds. There is no excuse. What we had today was a stand-in minister telling Victorians, come on the journey with us, and basically blaming Victorians for the failures of the Andrews government. I mean, it is so incredibly appalling that the Andrews government are blaming Victorians for the failures that they have been presiding over. This is years of mismanagement, years of underinvestment, and now we're paying the price.
How do you believe it should be fixed? If you were to be in government at the end of this year, what would you be doing? Getting more emergency care beds into the hospitals so that people can be admitted more quickly?
Well, Chris, we've got to fix this issue, and if it needs resources, it needs support, that's exactly what we'll do. But we need greater visibility. We need to understand where the gaps are. The government keeps saying we'll throw more money at it. Well, clearly that's not working. Something else is going on. You can't blame COVID. These issues were before COVID, and COVID's tipped it over. So it's years of underinvestment and mismanagement. But we need to be able to fix this crisis. The Andrews government clearly haven't. They can't. And truly, it is really going to mean a change of government in November to fix this ongoing crisis. We cannot have this ongoing.
Well, you're losing some staff for 7 days at a time if they test positive to COVID, of course. But what about vaccine mandates? Are any staff in the ambulance service or the health system being lost to vaccine mandates?
Well, I've asked that question through the Oversight Committee, and they've said not very many have been lost.
So you can't afford to lose any, surely?
None. We can't afford to lose anyone, but how many people are losing? How many are we losing from the system because they just can't cope anymore? I've had senior clinicians saying, we've had enough, they're walking away. This is a really serious situation, and as I said, it's not because of COVID. This has been years in the making. It's years of underinvestment and mismanagement. And Andrews has been the Premier and the Health Minister for 11 of the past 15 years. So he has to take responsibility for this. And this is, we've lost 21 Victorians have lost their lives because they couldn't get through to 000 or get an ambulance. That is unacceptable. This isn't happening in other states like it is in Victoria.
And what happens when a code red happens? Are the public advised, or do you only find out when you ring 000 and you can't get an ambulance?
No, the public aren't advised. That's the incredible thing. Why is the government hiding these alerts? Why isn't the government saying to Victorians, we've got this issue going on, you're not being advised, and you've got these excuses from government? It is outrageous that this is going on and continues to go on. They're trying to cover up the failures, clearly, by not alerting the public. Yet,
Well, you'd want to
when
know.
you
You'd
get an
need to know,
ambulance-
right? If you know there's no ambulances available, you
Correct.
might make another decision, like move someone to a hospital yourself quickly.
Exactly, Chris. And this is just the extraordinary mismanagement and the cover-up and the ongoing failures and the secrecy from this Andrews government. It is appalling and it is costing Victorians their lives.
I know you'll keep on it and we'll keep following up with you, Georgie. Thanks for joining us.
Pleasure, Chris. Thank
Georgie
you.
Crozier there, who's the Shadow Minister, the Liberal health spokesperson in Victoria. What a shocking situation for a first world nation, hey?